Today I'm going to be talking about the athletic trainer's role in concussion management. As an athletic trainer myself, there's nothing scarier than going into your first job and you have a concussion and you're just, what do I do with this? I remember the first time my sophomore year while I was in undergrad, and we had a patient come into the athletic training room with a concussion, and our program director just said, "He's yours, go." And you have to be prepared to go through the evaluation process and then prepare a concussion management program for that athlete. And as we all know, not every concussion is the same. Every concussion is different. And you really have to treat every patient individually and be prepared as you go into your first job to handle these types of injuries. And so where does the athletic trainer fit into this role? You're going to be asked commonly to do baseline testing. And with that, it's usually going to come upon you to set up the testing, make sure everything is ready, make sure your computer lab is ready. You can train your coaches, your athletic director, volunteers. Anyone can administer impact baseline tests. And so we have training programs that are free on our website. We strongly encourage you to have, when you go into your first job, your coaches, AD, volunteers go through that short free training process so they can better understand why they're doing baseline testing, why it is so important to get your athletes baseline tested, and why they need to follow protocols for baseline testing to ensure that they have good, valid baseline test results. And then a big piece of it too is when you go into your first job is doing the sideline evaluation. I remember the first concussion I ever saw when I was practicing right out of school. It was a really bad concussion. The kid could barely walk, he was so dizzy. We sat him down on the sideline and he hardly knew where he was. And I was in the middle of my evaluation and another injury happened on the field. Ran out and the other student had dislocated his wrist, elbow, and shoulder. And it prompted an immediate EMS call. And so, you're taken away from that injury. And, my first job, I didn't have a great protocol in place. The parents came down from the stands onto the sideline, took their student and wanted to take them home or to their physician. And the ambulance that I had called for this injury that I was dealing with all of the dislocations, stopped, saw the student who was concussed and on the way to his car with his parents, stopped them in the middle of the parking lot. I'm not sure why this happened. Talked to him and decided that they wanted to transport this student. And so I see my ambulance coming, and then my ambulance is leaving and I'm still on the field with my athlete and wondering what is going on. And this is where you need to have those protocols in place to have awesome communication with your coaches, with your athletic director, whoever is in charge that day, be it an assistant AD, whoever is there to help you out so that they can go direct EMS, everything you need when those situations arise. And part of that is having your good policies and procedures in place. So, that was my mistake. I didn't review, early on in the summer, the procedures that had already been written when I arrived to the school. I figured everyone knew them, and that was not the case. Every year you want to review your emergency action plans, practice them with everyone who is involved, practice them with your coaches, with any staff, even call in your fire department, have them go through the emergency action plan with you. Anytime you have any new facility changes, you're going to want an emergency action plan. I was in a situation where a lot of times my games were all over the place. I would have a volleyball game going on in one gym, I would have a soccer game going on across town, I would have football practice going on in our practice facility. You have wrestling in the weight room, just people all over the place. But you have to be ready to have an emergency in those situations for each location and have a plan in place. And a concussion policy needs to be a part of that plan as well. And you should bring in, not just your coaches, not just your athletic director, bring in your superintendent, bring in your school counselor, bring in your school nurse, have everyone sit down and work on your school policy or even a district-wide policy for your concussion management protocol. Even with the teachers, do you have academic policies in place for your students when they have concussions? You want to have everything written down and set in stone, so when you have that first parent who comes up to you and says, I want Johnny to play on Friday night, you have a good answer for them, because you're going to have those parents who are going to come up to you and argue with you, and you're going to have to be able to back yourself up and have the documentation and everything in place to be able to keep your athletes safe, because you have the policy in place that allows that. You're also going to be called to be the school point person for any injury, and concussions especially. So oftentimes when you go to your first job, you may already have a team physician in place that has an established relationship with your school, has worked with maybe your predecessor, maybe they are just doing a good thing and they want to volunteer for you. But if you don't have one when you get to your first job, you're going to want to do your research and get a team physician in place. Every team needs a team physician. And as that school point person, you are going to be facilitating with that team physician all of their referrals when a concussion occurs. Communicating with them, have your physician's number in your phone. They want you to text them and call them and be in the know on what is happening with these injuries. And I would text my team physician late at night on a Friday. They would come to the game and then go home, and I would get to the training room and someone would come up and be like, hey, that very last play, I kind of got rocked a little bit and now I don't feel so great. When I was on the bus, I just got kind of sick. Your team physician isn't there anymore to see that injury, and so you need to facilitate a referral to them, for their Saturday morning clinic, get them in as soon as you can on a Monday, or, if the need arises, to be able to send them to the ER that night and make sure you know who's your on-call physician for the ER that night. If you're working with a larger practice, you should always know who's going to be there on call for your Friday night games. It's nice, for the parents when they're loading their kid up into an ambulance and they're scared and be like, when you get there, Dr. Such and Such is going to be there. He's going to take great care of you. I have his phone number. Here's my phone number. Be in contact with me. And as a school point person, you're also able to follow up and communicate details to the coaches that they need, get all the documentation that they want, and also facilitate referrals for rehabilitation. Oftentimes concussions are bad enough that they do require extensive vestibular rehabilitation, vision therapy, doing exertional therapy in clinic with a physical therapist. Some concussions see occupational therapists because they're very much affected in their vision and how they can do day-to-day tasks. Are their activities of daily living affected because of this injury? And coordinating the referrals, you should always, default to your team physician, but also have good relationships with other practitioners in the area. There's nothing worse than when your kid goes to, a competitor for your team physician and they don't want to work with you because you work with one of their competitors. And so it's important to try and have that good relationship with every physician that you work with. Be upfront, like, hey, I need your clearance notes, I need your protocols, your outlook is for the best of the athlete. What is best for this athlete? It's not, the doctor's ego. It's not your ego. It's what are you doing that is going to keep your athlete safe. And a lot of times, especially if you're in a school level, college, high school, you're going to be facilitating that physical and cognitive rest for that athlete. You should default to your academic accommodations that you have in place, your concussion protocol that you have in place, and work with the teachers, work with your school psychologist, work with your school counselor to make sure that the athlete is getting the rest that they need. They may need to stay home for a couple days and rest and just kind of tune themselves out, shut down for a little while and allow their brain to recover from this injury. It's not uncommon to have students out 3-4 days for a concussion. And then working with your school nurse, I've been in several situations where I have either a great school nurse or a not so great school nurse. A lot of times they just don't understand your role at the school level. And so, you want to come into your first job and start off your relationship with the school nurse on the right foot. You want to say, hey, this is why I'm here. I'm here to help you. I'm here to help our athletes. If you get any notes that kids need to be out of PE, let me know because I need to keep them out of athletics as well. And just make sure you're keeping the line of communication open with them. Oftentimes they just really don't get what you do, and you really need to explain to them, why you're there. You're not there to make their life more difficult. You're there to make it easier. Just like they're, there to work with you and facilitate proper care for your athlete. Having good academic policies in place will also be a place where you want to have a good relationship with your principal. You're going to want to have a great relationship with all of your school counselors. They're going to be your best friends in making sure that the student is getting the rest that they need, whether it be, we need to not be testing right now. Maybe they need a proctor. They need a note taker. Maybe they need some extended amount of time between classes to rest. Maybe they need to go lay down in the nurse's office, at lunch every day. Just work with them and create a plan that you can have in place for these students. And so the teachers aren't like, hey, Johnny didn't need this, but why does Billy need this? Well, this is why we have this concussion policy in place. And you have everything ready to go and documented. Documentation is the best way not only to keep yourself safe from liability issues, but also just to back yourself up on the reasons that you're doing what you're doing. When you have that good documentation and policy in place, everything is going to be much easier for you, especially as you go into your first job. And then coordinating with the academic accommodations and that physical and cognitive rest. When they're ready, you'll have your return to play and then your return to learn policy in place as well. With return to play, especially with concussions, not every athlete is going to be the same. If you're going through, a more traditional 5-step return to play program, it may be that, they go through step 1, they go through step 2. We got caught up on step 3, we're gonna maybe pause now, maybe go back to step 1 or 2 and work your way up until you've gone to a full return to play protocol. And at that point, you also need to make sure that you know your state laws and regulations or even local laws on what you are allowed to do as a professional. You can look at your laws, and some of them can be interpreted a little loosely, and that's where you can contact your state athletic training representatives, your district representatives, and say, hey, I'm very unsure on what my scope of practice is here. What am I allowed to do as an athletic trainer in regards to concussion return to play? And they can help guide you towards what your proper laws and procedures allow for your scope of practice. Some states do allow athletic trainers to make return to play decisions for concussions, while others say it has to be a physician. And so it's important to find out exactly where your state stands on that. as students, you want to be as prepared as you possibly can going into your first job. There's nothing scarier than going into your athletic training room on that first day and you're just overwhelmed and excited and ready to go. Maybe you're in a situation where you're by yourself for the first time, and there's nothing scarier than that. Maybe you're lucky enough that you have some mentors where you can feed off of them, feed off of their ideas. Maybe you're an assistant and you have a head athletic trainer, above you that is going to be your guide and your mentor as you start your first job. But, at the end of the day, you're going to be at games, you're going to be at practices, you are going to be in the athletic training room, by yourself for the first time in most instances. And so you need to be prepared. That's where Impact Applications has created the Impact Trained Athletic Trainer program. And it's not, just here's what the impact test is. It's much more than that. It's going to go through how to read the impact clinical report and then make decisions based on how you want to care for that concussion, based on what the clinical report is showing. There's a great class in there on academic accommodations that gives some suggestions on how to work with your school nurse, your athletic director, your principal, counselors, school psychologists on creating a great academic accommodation protocol for your students. And then my favorite course is our Concussion Clinical Trajectories course, which goes over 6 different clinical trajectories that a concussion can take. Sometimes it takes one of them, sometimes it takes all of them. Is this concussion following a post-traumatic migraine trajectory? Is it going down more of an anxiety directory where you need to bring in that school counselor and say, hey, this kid, he got hit pretty hard and has this concussion and now he's, having a lot of anxiety issues. How can we work with him on this? Oftentimes some students will go on medications for anxiety temporarily post-concussion. And then also vestibular ocular trajectory. Are you getting that student into vestibular therapy to improve their balance? There's just lots of great clinical pearls within the Impact Trained Athletic Trainer program. When you're ready and you need the CE credits, it is worth 8.25 CE credits. 2.75 of those are those wonderful and elusive evidence-based practice CEUs. Impact Applications strongly encourages a multidisciplinary approach to concussion management. So having your team physician, having your physical therapist that you're going to refer to, having your school nurse and a great relationship with them, having an occupational therapist if that's a route that your students need to go to. And with that multidisciplinary model, we've created training programs not only for athletic trainers, but for those individuals as well. We have our Credentialed Impact Consultant program for physicians, the ITPT program for physical therapists, the ITRN program for your school nurses, and the ITOT program for occupational therapists. And having them all go through these programs together helps you create that great multidisciplinary concussion management model where you're all working together and collaborating to create the best standard of care for your athletes.